Mr. Ratan Jalan. We all are aware of the 4 Ps of marketing. Now, we all are excited to unbox the missing piece of healthcare. The first session is by Mr. Ratan Jalan, who comes with nearly 40 years of experience. He has been the president of Lintas Direct, CEO of Apollo Health and Lifestyle, and is now the founder and principal consultant of Medium Healthcare Consulting. Hereby, I invite who considers himself to be a student forever, wherein we consider him as the Pitama of healthcare consulting. So, please share your thoughts on the missing piece in healthcare, primary, preventive, and promotive, and of course, the patient.
Good morning, everyone. I think the first session is always a tricky one, and if I do a good job, then consider it to be the trailer for the rest of the session. And if I don't, then blame Vishy for calling me for the first session. But I think I made it clear, or I wanted to make it clear in the beginning itself, that I'm not a doctor, and it's important because I've seen quite a few sessions or quite a few places they make the mistake. And then when you're having a coffee break, somebody will come to you and say, Doc, let me tell you this reverse case of thrombosis when the septal wall got thick, and then you really feel embarrassed and telling the person that you actually don't know much about medicine. So here I am, and I'm going to talk about the 4 Ps of healthcare, and I think I've deliberately wanted to keep it slightly unusual. So this is not something which you'll get to hear very often. But I thought, being the first session, I can take some liberties in. So the first P of healthcare is actually primary care. And why I'm saying is that unfortunately, what I've seen in this country is that whenever you talk about healthcare, people think it is hospitals. And it's not just hospitals, it's those large tertiary care hospitals. In fact, there was a cover story in India today a few years back, which talked about golden era in Indian healthcare. And can you guess what they talked about? They actually talked about, the Apollo, the Fortis, the Max, the Wokhart, and Manipal, and you name it. And they said, now there is so much of cutting-edge technology, great doctor, world-class clinical outcome, medical tourism, et cetera, and for them, that was the golden era of Indian healthcare. You go to any of the CI or FICCI conferences on healthcare, and every year, trust me, you will find these large multi-speciality hospitals dominating the scenario. I have nothing against them. In fact, forget clinics, forget primary care, you won't even find a nursing home there. So I strongly believe that healthcare is not that. It actually is about primary care. Why does it happen that a simple case of diarrhea lands up in a large tertiary care hospital? Why does it happen? It happens because the person whose son or daughter or somebody is having diarrhea, you go to your physician, the physician doesn't do a good job of diagnosis or treatment, and after a couple of days it gets complicated. The kid gets into a nursing home. Nursing home makes its own share of money. It gets even worse, and then the only option you have actually is to go to a large tertiary care hospital. And I've always believed that if you take good care of primary care, if you do a good job, then you won't need too many secondary care hospitals. And if you do a good job of secondary care, which is, let's say, the nursing home for that matter, you won't actually need too many tertiary care hospitals. So in my mind, the most fundamental piece of healthcare actually is primary care. The irony of the situation is, if you read some of these reports, why India's primary healthcare is reeling, what primary healthcare in India needs a new delivery model, and why people are not actually focusing on primary care. The irony of the situation is that to vast majority of the people, primary care, as I've written, is a chiller business. You know what is chiller? See, somebody who's interested in 3 lakh CABG, would he be interested in 120 rupees ECG for that matter? It just won't happen. So primary care is a bit like McDonald's, is a bit like small restaurant for that matter, where you actually sell stuff worth 40 or 50 rupees, and you have hundreds and hundreds of outlets in the country, And overall, you make lots of money, and money the right way for that matter. So primary care requires a very different kind of thinking for it to succeed. And I always believe that the folks who are in large hospitals, even when they get into clinics for that matter, for them clinic is more of a catchment device. So what would happen? You actually would monitor conversion. So if a patient comes with a simple chest pain to a primary care clinic, somebody is going to feel disappointed. Am I right? So I'm just saying primary care is a very different kind of a ball game. It's a very different kind of a business, but it's something which is very fundamental, more so for a country like ours. And the people who have actually done a damn good job of primary care in the country, I mean, I would say, ironically or unfortunately, actually are people who have created social enterprises. So you have the likes of Search, and if some of you have heard of Dr. Abhay Bang and his wife, and they do it in a district in Maharashtra. Actually, he's got Padma Shri, but he's done a phenomenal job of primary care, phenomenal. I mean, on Saturday, I happened to meet another gentleman called Mr. Kapila, who's got great background. He actually has created a foundation called Swasth Foundation, which is focusing on primary care. So the irony of the situation is that a lot of good work is happening in bits and pieces, and it actually is happening, or it has been created by people who are creating social enterprises for that matter. But it has not yet reached, if I may say, it has not yet created the interest in the private sector for that matter. I think it's a pretty unfortunate scenario. I'm also saying that when you're talking primary care, in my mind, that's my observation, or that's my recommendation, that you actually are talking about a scenario where you need to reduce dependent on physicians. And I respect physicians, and I think it's just that in this country, you don't have too many physicians. And to that extent, you're talking about a solution which does not necessarily depend on physicians. And if you're talking about Dr. Abhay Bang, if you're talking about Swasth kind of a let's say, formula for that matter, recipe, what they have done, they've actually reduced dependence on physicians. You're talking about basically trained health workers, whatever you want to call them. You want to call them ASHA, you want to call them something else, but the model essentially comprises or focuses on trained healthcare workers. You're talking about a very strong community involvement. And you will find that in all successful models, that actually is the common thread, that you get community involved. There is a sense of ownership, there's a sense of commitment, there's a very clear focus on, let's say, on the right objectives for that matter. It's not about treating people, it's more about keeping the society or the community healthy. There's a very right focus. And the last, I think, is there is immense potential to actually leverage technology. Personally, I believe that there are people who say that if you're talking about a solution for the poor, then you can't afford technology. And I actually have an opposite view. That if you're talking about rich, you can do without technology maybe. But if you're talking about poor, it's even more important to leverage technology. And I'm just saying we have Dr. Ganapati. I would call him the father of telemedicine in the country, and I'm sure he's going to share some of his views. But there is so much which a simple phone can do when you're talking about healthcare. Whether you're talking about you being able to show a simple video to a villager, or you're talking about some messages, you're talking about reminders. So I think there is so much today technology can do to actually help healthcare without costing much. So that's my view. In fact, on the left, I have LV Prasad, the most famous institution probably in this city. They have something they call vision centers, and the fundamental pillar of the vision center is what they call vision guardian, who actually may be a girl from the village, okay, and maybe just class 10 or class 9 or something, but has been adequately trained to basically do early detection or some simple treatment of eye problem. So that's primary care. Then you're talking about preventive care. I think that's again, in my mind, as important piece. And why I'm saying is, so the world's most popular drink is now available in India, absolutely free. You can drink it anywhere. It doesn't smell. It doesn't cost anything. 8 full glasses a day now, go get drunk. Now, why I got this slide is that unfortunately, most of the good things in life are free. Coke costs you a lot of money, but water doesn't. Good sleep doesn't cost you money. Smile doesn't cost you money. A walk in the park doesn't cost you money. Not smoking doesn't cost you. Smoking does. Not drinking doesn't cost you. Drinking does. So the irony is that most of the good things in life, which we all should be doing, eating less doesn't cost. Eating more does. But the irony is that most of these things don't cost money. If they don't cost money and if they're free, there is no business model. You and I will never see Salman Khan promoting water. Would you see? Because there is no model there. I mean, Nike would sell you shoes, but nobody will ask you to go for a walk. If you buy a pair of shoes every third day and you don't even open the carton, Nike is not going to complain. So I think the irony of the situation is when you're talking about preventive healthcare, there actually is no business model. Which is why you will find that folks who are in preventive healthcare are the social enterprises, or maybe in certain cases in the US or otherwise, insurance companies. Because an insurance company would rather keep you healthy because it's going to cost them less than pay for your heart problems or heart treatment or other things. So I think that is preventive care. Now look at this. You have Johnny Walker. Can you believe it? The Johnny Walker, the liquor brand, tells you keep walking. Isn't it? You have Four Square, the cigarette brand, which tells you live life king size. I mean, it's so ironical. You have Wills, which says made for each other. Try telling that to your wife. That, how smoking helps, for us to live with each other forever kind of a thing. But that's the irony. Now, the good thing I always say, that if you have Lifebuoy or if you have Dettol, if you have some of these brands, I mean, Lifebuoy may be doing it to sell the soap. Doesn't matter. But are they doing a lot of good to healthcare? I honestly think so. If Lifebuoy can help us inculcate some healthy habits amongst kids from the early childhood, that you should wash your hands before meal, after you go to the toilet, etc., I think they're doing a phenomenally good job for healthcare. And it's actually preventive healthcare. So I honestly think that it doesn't matter whether there is a commercial interest or not, but you have the likes of these companies which I think are doing a damn good job of preventive healthcare. Now, like I said, that this is actually a study on healthcare in Thailand, and where they talk the same thing. They have 800,000 health volunteers across the country that played a crucial role in controlling many communicable diseases. For example, they talk about malnutrition for that matter. So you actually are talking about a large number of health workers whose primary focus is to control disease, not to treat disease. And in Thailand, because of the religious mix for that matter, a whole lot of work actually is done, as you see on the right picture, by Buddhist monks. I honestly think that if there is one individual who has done a lot for healthcare in this country, it is not the people we think of. It actually is Baba Ramdev. For 20 years, what the gentleman did actually was to promote yoga. Am I right? Through the live meetings or his conferences or seminars or his sessions or through the television channel he had. So I'm just saying, I think that is the traditional Indian, very high impact solution to a lot of problems, to prevention and stuff of that kind. I mean, if you ask me honestly, the two most major healthcare initiatives this government has taken, you're talking about Swachh Bharat Abhiyan. I think if you speak to a physician, he will tell you what toilets can do to healthcare. I mean, we are working with a very senior colorectal surgeon in Bangalore, and he says that what the problems and defecation do to millions of Indian women in the society, particularly in rural India. If you're talking about this scheme of Ujjwala, where you're talking about distributing, I'm just saying gas or gas cylinders to millions of Indian women in the society, I think the health benefits of that, I think, is not really understood. I'm sorry. Uh, Ayushman Bharat, fortunately, is actually focusing on wellness centers. And they're talking about setting up nearly 1.5 lakh wellness centers. I'll rush through. The third is, okay, this is something which I hadn't planned. In fact, I thought I'll talk about promotive healthcare, but this happened accidentally, and let me tell you why. That when there was a post about this conference, and I was going to talk about it, I get a message from Dr. Ashish Chaudhary who says that these days, he's a very famous orthopedic surgeon in Delhi. These days, we worry more about social media than culture media. Okay, we are talking about losing money, we are talking about litigation, doctor-patient relationship, etc., etc. And I certainly felt that if there is a P which we need to talk about, is actually the physicians. I mean, you have violence, and I think these cases are increasing more and more. Ironically, at AIMS, in fact, I read this, that starting May 15, the doctors will take self-defense classes from black belt champions in martial arts. I don't think that's a very healthy development. Now, why we are having such a scenario where doctors actually are getting threatened or burnout or stress and stuff of that kind? I think number one reason is media, because when you're talking about breaking news, I think it's always about something as sensational as this. What you see on the top right is deliberate, because, for example, yesterday I happened to meet Dr. Evita at Fernandez Hospital, and Dr. Evita was telling me that, Mr. Jalan, day before yesterday, we actually had a sick newborn who was in the hospital for 151 days, but no infection. It sounds like a miracle. And what I told Dr. Evita, that you can never make a news out of it. Never. If at all you're going to have a news, the news is going to appear the way I have put it on the top right. Okay, Times of India will have it somewhere in 3 centimeters or some such thing. So the point is, nobody talks about good news. And frankly, removing a 26 kg tumor is not good news. I'm just saying, I mean, you keep on reading about such things. So I think media is responsible. The government is obviously responsible. You may have n number of Gorakhpur incidents in the country. N number of Gorakhpur incidents where 40 kids would die because the medical gas, runs out. But the moment you talk about a private hospital, the first thing to do is to close the hospital. So I think it's something which is very unfair and just not right. We also have ourselves to blame for this scenario. And I think, I saw a play card where, when you're talking about violence against doctors, and this young doctor said that we are not gods, we're not demons, we're just human beings like you. So I think as a society, we also need to be very realistic in our expectations. The last one is obviously patients. And when you're talking patients, in fact, we did a research with about 120 patients across the country in 10 cities. And there are two things we found, that patients actually get very upset, feel very distressed, lose trust in hospitals, primarily because of financial reasons. Have you ever, and the second ever is deliberate, have you ever seen a hospital bill which is less than the estimate? Have you ever understood a hospital bill? I don't think any of us can. And I've seen people fighting about a hospital with 3,24,000 rupees, and the guy is fighting about 94 rupees purely because he said the doctor didn't come twice. Because that's the only thing he can count and understand. The picture on the left in a hospital lobby is what you see when there's a shoot for the brochure. What you see on the right is the reality. I think if we need to give a thought, I think that's my parking thought, that we have lost what medicine was. Thank you so much.
The stage is open for the question. No questions? So, the mic, please.
Yeah.
There.
Absolutely convinced it may take some time, but within a decade from now, tertiary corporate dividend declaring hospitals are going to get into primary care and preventive care, that's where the money is, purely from an ROI point of view. And I'm absolutely certain that the way the doctor is taught to diagnose and treat today is going to be totally changed. I just want to bring one quotation, what Sir William Osler said in 1930. He said, listen, 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 the patient is telling you the diagnosis. I belong to the BC era, before Christ and before. No, the last 42 years, I've been pained to see that when somebody comes with a headache, the young doctor asks for an MRI. All that is required is to listen, listen, and listen. And I'm extremely happy that you brought out this very, very important point.
Thank you so much, sir. Research globally done, which says that on an average, a doctor would interrupt a patient after 14 seconds when he starts talking. I've personally been to a government hospital where the patient would actually not even sit down. They would keep on standing in front of the doctor, and the doctor looks up, and his looking up means what's the problem? And the lady says, lose motion. The doctor doesn't even ask who has it.
What is your view on the registered medical practitioner at the rural area? Actually, government de-recognize, they don't recognize them, and they are the people who are addressing the healthcare at the base of the pyramid. What is your point of view?
I think instead of ignoring them and treating them as outcast, people who are quacks and are doing all, let's say, not so good things to society, I think it would be much more beneficial if we recognize them and actually provide the necessary training and tools and try to integrate them into the system and society.
That's pretty good. I agree with you.
Yeah, it's not a question from my side. I mean, I just want to share a bit of insights. Really happy that this kind of session took place, particularly when we think about the evolution of future healthcare. It's a change from acute care center slowly and then coming down to ambulatory centers. So basically from hospital center to patient centered. So I like the concept of primary care centers, which need to be more strengthened. It will be more strengthened in future because healthcare is moving more towards the patients. Particularly, I mean, India, kind of emerging countries, when we take the case of Asia Pacific as a whole, even in developed countries like Singapore, government is seriously thinking about taking how technology can reach even the older people. For example, they cannot even access the technology.
Absolutely.
They cannot even come to the hospital.
Absolutely.
So how we can bring a kind of kiosk right near to them.
Absolutely.
So this is really a leveraged version of what you've really explained, sir.
Absolutely. Thank you so much.
Really appreciate this kind of
Thank you so
thoughts.
much.
Thank you very much. Yeah.
And maybe one more question.
Great speech for an youngster like us, sir. Sir, how do we deploy this trained healthcare community workers, or so-called, you have said, when the MBBS physician training is still in its dark ages?
So I think if you're talking about how do we reorient or redo or recalibrate or reformat the physician training, I think I'm certainly not very well qualified to answer that. But as Dr. Ganapati said, that somewhere I think medicine should be taught in the, like he said, the before Christ era. I mean, I think some of those practices, value systems, obviously needs to be brought back to the society, which is missing. So, thank you so much.
One more question, sir. How do you think that we can deploy this? I mean, this kind of a training, how do you get into the society?
So, which is where I said that whoever is doing it is actually involving the community. See, whether you're talking about urban or rural, it's not about involving a district or a village or a panchayat. Even in the urban context today, I know there are places, very isolated examples. Could you have a Srinagar colony society where you involve some people and their responsibility actually is to ensure that the members in the society stay healthy? Can you do that? It is feasible. So I'm just saying community involvement, whether you talk about urban or rural, poor or rich, I think it's very much possible.
Thank you, sir.
Thank you so much.
Thank you so much, sir. I would request Dr. Malpani to present the token of appreciation to Mr. Ratan Jalan.
Sorry, sir.